Ma'am,
Please
you,
go
you are
ahead.
going to start any recordings, ma'am, or else shall I start?
Yeah, you can start.
Okay, ma'am. Good evening, one and all. I'm happy to welcome you all to this second positive mental health 12th session. Today topic is DBT, Dialectical Behavior Therapy by our resource person, Dr. Jenny Raff, psychologist from Tiruchur. Welcome, ma'am. I welcome once again all of you and resource person by myself and on behalf of Tech on Positive Mental Health, Manasa Shubkara, Hyderabad, Elupon Counseling Center, Hyderabad, and Forest Art Studio, Punjab. I'll also hand over session to give intro about our resource person to our team. Thank you. Over to you, friend.
Yeah, thank you, Vishal. Welcome, Jenny ma'am. She is 21 years of experience as educator and 7 years as psychologist. She did a PhD in psychology from Bharatiyar University, Coimbatore. 27 years of paper published so far in psychology and education, around 60 articles she published in various magazines, circulated in India and overseas as well. Attended national and international conferences and seminars. We welcome you, ma'am. The floor is yours. Please go ahead.
Thank you, Vishal. Thank you, all the participants who are looking forward for this presentation. And my heartfelt thanks to Manasa Shubkara Mind Care, Hyderabad. And I feel proud to be here for you in order to speak about this dialectical behavior therapy, which is very much the need of the hour. We can say that because all the people who are very much enthusiastic to work in the field of mental health will be benefited from this presentation. But I am, as usual, I am a little bit afraid to speak about this extensive topic within this stipulated time, that is 45 minutes I am allowed to speak. And anyway, I will try to compress all the points and put it forward more succinctly, actually. Let me share the window for you. Here it is, dialectical behavior therapy. And you see that any therapeutic, as in the case of any therapies, it has its own principles, perspectives, and philosophies, and way of putting into implementation as far as any scientific therapy is concerned. We will be going through the main points and principles and definitions, concepts that is incorporated into this dialectical behavior therapy. And I think it will prompt you to go deeper into the topic, this presentation. So let us begin with the word dialectics. What is meant by dialectics? Dialectics, it is a cooperative exercise that happened between two or more people, two or more parties, two or more groups who carry different viewpoints or different ideas, different perspectives. This is the actual meaning of the word dialectics, and the final consequence of any dialectics is this, that is, we have to reach at a middle path, that is the persons involved in the dialectical conversation or cooperative exercises, in order to reach at a solution or answer, we can see that they will be reaching at a conclusion or solution for a situation or an issue in such a way that no party is felt left out, or in other words, every parties involved in dialectics feel that they have got their part or their share as far as the solution of the situation is concerned. That satisfies every parties involved, even if it is a person or two or more person. This is the fundamental meaning of dialectics. And we can say, in other words, that it is about finding both, and both, including both, we produce a solution or answer to a situation, to a problem, that we create a solution in such a way that the persons, all who are stakeholders, experience that it is useful to them. It is not in terms of and or. That is, dialectics is a process of finding middle ground from either or to both and. We avoid black or white thinking. That is, we enter into a state called black and white thinking. That is, we accommodate both both states, that is black and white, and reach at a state where there is black, where there is white, such and such things, and emerged from repetitive, ineffective interventions, counteracts rigidity. Because the basic idea of dialectics is to counteract the inflexible way of thinking. That is, if you take any psychological disorders and psychological ailments, if we analyze the client, we can see that they will be harboring some sort of inflexible thinking. So dialectics help to beat this inflexible way of thinking. Rigid boundaries are broken. That is, it is considered to be a form of CBT, actually. It is an elevated version, I will say. I would like to call like that. It is an elevated version of DBT, sorry, CBT, developed by a person called Marshall Linhan, commonly used with, and it is found to be highly effective in treating borderline personality disorder. Not that all other disorders or ailments are not going to get benefited from DBT. It is not like that. But borderline personality disorder is the major ailment which has been found to be very useful by using this therapy. Also used with people with depression, substance abuse, and eating disorders, and like that. And suicidal thoughts and actions and self-injurious behavior has been treated by effectively by DBT. And this is the portrait or a profile of the person, Marshalline. She is a lady, and she has borrowed perspectives, views, and principles from all these thinking, that is orientation, systematic transactional approach, and CBT, Buddhism, and principles of dialectics. He has conglomerated, we can say that, all these ideas and produced this dialectical behavior therapy, and it has been found to be very much helpful. I will say that some part of the cognitive behavior therapy, cognitive behavior therapy is missing some aspects of the human mind, and this dialectic behavior therapy completes the cognitive behavior therapy, as far as my personal opinion is concerned. And DBT has its own definitions or conceptions regarding how mind works, how emotional situation of the clients works. And according to DBT, it says that human mind has a basic tendency to think or understand concepts in a dichotomous fashion. That is, we have a tendency to evaluate situations or things or objects or persons as good, bad, either good or bad, either happy or unhappy. We don't know that middle path. Human mind has a basic tendency to work like that. So we forget to understand and appreciate the middle path, and we stick to these polar opposites, either good, either bad, either bad, or either true or false. We don't know whether there is some middle path. Our mind has a tendency to move towards polar extremes, and it is the basic tendency to move towards the polar extremes, which creates inflexibility in thinking. And it is a distinct characteristics of any client suffering from various psychological disorders, including depression, anxiety, whatever it may be. Cognitive biases or cognitive errors, basis of it is inflexible thinking. So, and also with regard to emotional realm, DBT, he gives so much importance to the emotional regulation capacities of the clients. That is, if we see that, if we analyze the persons suffering from psychological disorders, we can see that their emotional life will be very much disturbed. That is, their emotional regulation capacity will be very, very, very low. That is, they will be quickly aroused. That is, they react with a highly emotional state, with situations which are less stressful. Even a symptom, even a sign of stress is enough to react very intensively to the situations, various stress provoking situations. And their arousal levels in emotional situations can increase quickly, and they take time to return to the baseline. And these are some concepts or definitions that DBT carries with it while explaining this basic principles and perspectives of this therapy. So we can say that DBT embraces biosocial model, especially when it comes to explain this disorder, psychological disorders or psychological ailments. Says that person will be the Lenihan's theory is based on emotional regulation, dysregulation. It has its own way of DBT has its own way of explaining what is emotional dysregulation and how it happens, what leads to it. According to this theory behind DBT, Lenhan says that vulnerability is something. What is meant when we discuss the word vulnerability in psychology or psychiatry? We say that vulnerability is something that we inherit. Our basic blueprint of our genes is in such a way that we are vulnerable to certain diseases, certain state. So emotional vulnerability means that we are born with some hereditary factors which make us more vulnerable to get aroused, emotionally aroused towards the stress provoking situations. But But according to this theory put forward by Linhan, emotional, even if you have a person or person is born with emotional vulnerability, that is, he carries some gene or genetic predisposition is there to get easily aroused towards the stress provoking situations. He is born with some emotional profile like that. That doesn't mean that he or she is likely to experience emotional dysregulation. Your genetic predisposition to become to have this emotional vulnerability does not mean that you are doomed to become emotionally dysregulated person. No, only if there is invalidating environment, this emotional vulnerability can come into action and produce the thing as a consequence called emotional dysregulation. That is invalidating environment, especially when the child is going through developmental phases. His or her environment is not emotionally validating, or invalidating environment is there, the person or the child is likely to experience this emotional dysregulation. That is, in other words, emotional vulnerable is someone who's, we can say that, who is emotional vulnerable. Emotionally vulnerable person has a special way of functioning of autonomic nervous system. His nervous system reacts excessively to relatively low stress levels. That is, it takes longer time to return to the normal levels, even after the arousal state. So emotional dysregulation is seen as a result in the transaction between biological disposition and environment. That is, we can say that what is meant by invalidation. When the child is going through his environment, going through his or her environment, developmental phases, suppose that he has some certain kind of home environment in which the child's personal communications, I repeat the word, personal communications are not accepted as accurate indication of her true feelings. That is, his feelings or his emotional needs is not properly recognized or validated by caretakers, especially the parents. So if the child carries some emotional vulnerability, he is likely to become a person who is likely to experience emotional dysregulation. So invalidating environment combined with the emotional vulnerability produces a state called emotional dysregulation. And this emotional dysregulation can be noticed in most of the persons, in the case of most of the persons suffering from psychological disorders, because child fails to take up lessons regarding labeling his emotions, regarding controlling his emotions, and regarding how much arousal is needed towards a stressful situation. Such lessons child fails to take up due to this invalidating environment, home environment, especially parenting. So this is the gist of this emotional dysregulation, and the theory reiterates that these biological principles, that is emotional vulnerability plus maladaptive inadequate emotional regulation strategies produce emotional dysregulation. And DBT has its own framework. That is, it is based on four factors. That is, skills training will be there, individual therapy will be there, at the same time, group therapy will be there, and telephone consultation will be there. It depends upon the need and requirement and demands of the problems, the situation, or the situation, the current situation of the client. And it has its own framework for approaching the therapy. And there are some assumptions, definitely. That is, clients are doing their best they can. That is, when there is always positive attitude or some belief in the potential of the client to make some basic changes in himself. Clients want to improve, but some or for some or other reason they are not able to come out of their complex situation. Clients must do better, try harder, and be more motivated to change. Clients may not have caused their problems, but must solve their problem. Anyway, clients' lives are unbearable, and clients must learn new behaviors. Clients cannot fail in therapy. Therapists need support. All these things, these are the set of assumptions, and I have presented only some of them. And you must go through these assumptions in detail if you are really interested in this therapy, that is dialectical behavior therapy. And you see that problematic behaviors, client is in love with it. That is his ineffective response patterns. If the therapist reinforces his ineffective ways, the client will like to stay in the therapeutic relationship. But whenever the therapist challenges this problematic behaviors, client will it will be dangerous, because client will show the tendency to leave the therapy. Only way to realize the meaningful life is through the practice and more practice. And dialectical behavior therapy gives much importance to the practice, because skill development is the focus of the therapy. That is, if we these are the best characteristics of the therapy. That is, it is support oriented. That is, we focus on the positive aspects of the client. A client will be sitting in front of you, not at all. He will be having some positive aspects in his behaviors, in his attitudes, in his views. We try to strengthen it with the help of strengthening his basic potential. We try to beat the negative one. And cognitive based strategies we make use of in dialectical behavior therapy. And collaborative, it's a nature, basic nature is collaborative. That is, group sessions will be there, individual sessions will be there. So it is a dialectical approach, actually. Yes, people role play new ways of handling relationship, and so many therapeutic strategies are there. I cannot list it out here. Anyway, one thing I point out is that dialectical behavior therapy has mainly, we can categorize its objectives into two. The first set of objectives, we can call it as acceptance. The second set, we can call it as change. Acceptance is the therapeutic effect that happens inwardly. That is, acceptance with the help of mindfulness practices and with the help of this distance tolerance techniques. We prepare the ground, we prepare the ground inside the individual or the client, so as he makes some perceptible changes, visible changes in his behavior, in his emotional responses. So acceptance portion is executed first in almost all therapeutic episodes or situations. We prepare the mind of the client in order to make some changes. As a part of it, this mindfulness practice is given to the client. And regarding the mindfulness, becoming aware of and present with our thoughts and emotions. This is the aim of mindfulness practice, because you can see that we can change any patient, any kind of change we can bring forth in any patient only if the patient has at least some level of awareness regarding his thoughts, his emotions, his behavior. He must be capable of at least to observe himself. Then only, irrespective of any kind of therapy, this is the truth behind the success of the therapy. That is, the more the person grows in awareness of his emotional, behavioral, and cognitive thinking patterns, the more the person becomes aware, the change will happen. Change will be facilitated, in other way. So this mindfulness practices what it does to the person. It helps the person to create a comfortable distance between himself and his thoughts, between himself and his emotions, between himself and his behavioral response, emotional response, and all that. So there are so many techniques in order to grow in mindfulness, grow in awareness of oneself, practicing controlling our attention, never about controlling of thoughts. Mindfulness is not about controlling the thoughts, actually, my dear friends. It is about growing in awareness of our thoughts, unless every single aspects of, yes. And there are so many techniques, effective techniques, learning how to control your mind or attention so it does not control you. There is a situation like that. Only those who have practiced mindfulness can become aware of it. Otherwise, you can just comprehend the idea, but you have to experiment with this mindfulness in order to know it in a depth, in a deeper manner. So mindfulness activity has four sets of skills in its as its objectives. That is, the patient learns to observe what is going around him and what is going inside him as well. And the patient must be capable of observe and describe, that is articulate in words, what is happening inside him as well as outside, and participate, that is full attention. The patient will develop a state called he will be capable of involving himself on a particular activity, whether he is eating food, whether he is walking, whether he is doing some other tasks. He will develop a capacity by practicing the mindfulness to involve in the action fully, 100% of involvement. So when this observing and describing and participating, it has some quality. That is, the patient must be capable of observing in a non-judgmental fashion. How skills, that is, skills are this. On the left side, you can see the set of skills that patients are supposed to develop. But these skills have a distinct characteristics. That is, how observe non-judgmentally, describe non-judgmentally, stay focused, do what works. All these skills will be trained for the client in order to ameliorate his situation. And regarding the emotional regulation, change our emotional regulation is not about controlling the emotions or suppressing the emotions, but it is about changing the client's responses to his emotion. Gist of emotional regulation, that is, we can change our response to our own emotions only if we are capable of observing our emotion, becoming aware of emotions. So emotion regulation, it's not about changing or controlling our emotions. Instead, it is about changing our reactions to emotions. So there are a set of skills that will be helpful in order to produce a state called like this inside the client. These are the, that is, the client will reach at a state by observing his emotions, by becoming more and more aware of his emotions, and by becoming more and more aware of the situations which are likely to affect him or her emotionally. So growing in awareness regarding one's own emotional responses. So these are the 5 skills that client must develop with the help of the therapist or and his aides. That is, the event prompting the emotion. The client will be able to identify the set of events that are likely to prompt his emotional upsurges. And interpretation of the event. What kind of interpretation he is making about the event, particular event, which is causing emotional, intensive emotional responses in him. And phenomenological experience, that is when he is emotionally aroused, what is happening in his system, in his biology, in his temperature, for example. That is, he will be aware of what is happening in his body, including physical sensations, and what is happening to his thinking level. He will grow in awareness, the behavior expressing emotion, and what is his response to the emotionally provoking situations, and after effects of the emotion. If he becomes highly emotional or intensively emotional to a stress provoking situations, what are its consequences? All these things are brought into the awareness of the client before teaching him some techniques to regulate his emotions. There are so many techniques, starting from breathing technique. There are so many techniques, but all these breathing techniques and yoga techniques and whatever techniques it might be, these set of things must come into the awareness of the client in order to produce a fruitful outcome in during the therapeutic procedure. And also distress tolerance. Distress tolerance is focusing on skills to develop, get through a crisis situation. A situation is crisis for an individual, for a patient. A minor situation or not so serious situation might feel like a crisis to him. No? Low stressful situation might be a crisis to a patient. So help get through a crisis situation without making matters worse. Not intended to help the clients feel better. Anything can help tolerance and willingness and versus willfulness. Rather than willingness, we generate a certain willfulness. I think that you can understand the meaning of willfulness. And mindfulness practice, going back and forth, back and to skill years. And you see that when we say distress tolerance, getting through the moment without making matters worse. This is the focus, distress tolerance. Distress is something that happens in everybody's life. We cannot save ourselves, or we cannot ourselves protected from the negative life environments and life situations. But what we needed is to the capacity to go through the distressful situations in our life without making the situation worse. So distress tolerance will be there. And these are the set of the skills that we focus in order to generate it. That is distraction, self-soothing, improving the moment, thinking of pros and cons, and more are the actually distress tolerance skills. And you see that interpersonal effectiveness. In most clients, if you take especially the patients suffering from borderline personality disorders and bipolar disorder and other depressive disorders, whatever it may be, where the emotional dysregulation is the basic characteristics of the disorder, means that their interpersonal relationship will be suffering a lot. They will not be capable of enjoying the relationship with even with the near and dear ones. So this is one of the features of DBT. DBT focuses on making this interpersonal life of the client better. So it will be teaching how to get along with others more effectively. So the focus of this interpersonal effectiveness, helping the client to get their needs met. Clients have some needs: need for love, need for acceptance, need for recognition. There are so many psychological needs apart from some material needs. And this interpersonal effectiveness and all that will be helping the this region of therapy will be helping, or this part of the therapy will be helping helping the client to get their needs in a way respectable to both and self. So there is no the question of manipulation, that being aware of one's own reaction to others. This is the basic of interpersonal effectiveness, that is being aware of one's own reaction to others, as well as learning to respect the others responses and reaction to ourselves. getting our needs met while respecting both ourselves and others. And there is assertiveness skills training will be there, interpersonal problem solving classes will be there, and asking what one needs to say no to, and coping with the conflicts. All these things are incorporated in the dialectical behavior therapy, obtaining changes that one wants. So interpersonal skills will be developed, must be, because it is a need for beating any kind of psychological disorder, because disorders depression and cannot be solved, or we cannot take the healing process to a successful state without the help of the cooperation or support from the family members, or at least 2 or 3 intimate relationship should be there in the life of the patient in order to facilitate the healing process, especially in the case of psychological disorders in which there is high emotional dysregulation. Anyway, DBT studies. Don't think that DBT is not so famous. So many studies have come out in this about this therapy, and these are some of them. And on the right side, you can see that the list of disorders, and BPD is the major disorder which have been found very much fruitful in the case of dialectical behavior therapy. And you see that these are the finally I am entering into the final state, that is these are the advantage of DBT over other therapies, that is decreased treatment length, that is usually a therapy takes 52 weeks, and it has been, we can reduce it to 16 weeks. And my conclusion is that DBT has an aspect, or DBT has a good part about it, that is it prepares the mind of the client in order to become more receptive, in order to become more receptive to the skill training. Whatever therapeutic techniques, it makes mindfulness practice and acceptance practice, means that it prepares the ground for the therapy to become more effective, more fruitful actually. And DBT is involves DBT make use of the involvement of family members in skills training formats, and involving family members individual sessions when necessary, and adaptation of skills to adolescents, use of age appropriate language in handouts. So this is the overview. I would like to call it as overview of DBT, rather than an extensive presentation on DBT. It is only if I have touched only the periphery of this vast literature regarding the DBT. If you have any questions, please ask. I will try to answer.
Yeah, Jenny, it was a fantabulous session. We thoroughly enjoyed how to regulate our emotions and mindful practice. You beautifully explained. Yeah, friends, you can interact with Jenny,
Right
ma'am.
hand here.
Yeah, ma'am. Definitely, it's very beautiful session. And if I summarize this, I mean, if I say this is my learning from today's session, is that DBT actually make the person or client means he himself can will be in position to basically handle his problem, his future problem, and he is not basically dependent now onwards. Is it? Yeah, because we are doing mindfulness also. We are working on his thoughts also, emotions also.
Yes,
So
yes.
I think after doing all this therapy, he will be independent, and he will not be very dependent on the client, if I'm not
Yes,
wrong.
yes.
Yeah.
Final outcome. We aim for any patient to be self-sufficient in any
Yeah, yeah,
therapy,
yeah.
not only in DBT, in any therapy. The ultimate aim is to make the patient self-sufficient in order to deal with his emotional dysregulation, whatever
Yeah.
problems he or she has. And
Mm-hmm.
DBT helps a lot, because compared to cognitive behavior therapy, DBT is giving adequate importance to the inner realm. That is, that part of growing in awareness of one's own condition is given adequate importance in DBT. That is the beauty of DBT actually, compared to cognitive behavior therapy. And we make use of the skills. As you said, Payal Gupta, as you said, it is very true that the patient grows in get rid of dependence from others. Yes, it is true. It is the aim of any therapy. Ultimately, any therapy aims for it, to make the patient self-sufficient, even if not healed fully. Borderline personality disorder and in the case of bipolar disorder, the studies say that 100% treatment, 100% healing is not possible. So many studies are coming out saying this, but patient reaches at a level with the help of the therapy in which he is capable of dealing with or managing his situation in a better manner. So self-sufficiency, as you mentioned, that is, he becomes more independent compared to his crisis stages or his problematic situation. He becomes more free, independent to self.
Yeah, ma'am. Ma'am,
Self-sufficient.
one question. Sorry, ma'am. Sorry. You continue.
Rather than using the word dependent or independence, we can use the word self-sufficient. How much
Yeah,
self-sufficient?
true.
Yes. Okay, continue, please.
Yeah. Yeah, ma'am. Ma'am, my question is just like CBT, do we give homework in this also? We
Sure,
design
yes,
any homework
definitely,
also?
definitely. So much work. We saw in the slide, it is given that the client has to practice. So many client has to invest effort, and in the skill training session, we need the help of the family. If you wanted to make some homework, or we wanted to build up some skills, therapeutic setup will not be sufficient in order to build up a skill is something that client will have to practice on a daily basis. He must incorporate this skill training program into his daily life, daily routine. For that, we need the help of family members. Then only skill training. So homework is needed in order for the skill training to happen. Actually, yes, sure. And
Can you
yes, sir.
tell me the difference between willingness and willfulness? Slightly, I'm not very sure.
Willfulness is like a muscle. Actually, willfulness is and the more you make use of this willfulness, what happens is that just as we use a muscle, it loses its strength. We get tired and we need some rest. But wishfulness or what is this? Willfulness is something that comes as a desire, or it is a consequence of acceptance. We can say that, or it is very difficult to
I think
find some this.
correct word.
Yeah.
In Malayalam, we call it as Icha Shakti. Icha Shakti.
It is also Sanskrit.
Sanskrit. Yes, yes, good, very good. That we have to generate. That is, every patient has this basic potential for change, basic desire to change. That desire we may have to, by virtue of therapy, we have to activate this desire. This desire is lying dormant in order to change, in order to grow, in order to flourish in life. We stimulate that desire. It may express it is, we can term it as this desire to change as willfulness rather than willingness. Okay, yes,
Thank you.
sir.
Yeah.
Thank you,
Ma'am,
Jenny.
I have one question.
Yes.
Is this the dialectical behavior therapy applied to clients of all age group and all disorders?
Sure, but there are some restrictions. If all disorders, yes, we cannot say that it can be focused on borderline personality disorder. Some more and more successful cases are coming out in borderline personality disorder, but it has been found fruitful in other diseases also. And regarding the age restriction, I think that theory says that it is applicable to any age groups, but in order for the mindfulness practice to be effective, that some capacity to look inward is needed. And in the case of little children, we have to wait, we have to struggle a lot in order for the mindfulness practice to bring forth into effectiveness. A recent study in mindfulness says that mindfulness practice is not found effective among the school going children because they are not that developed to look into in a contemplative angle of looking within, has not been developed properly. So this aspect of mindfulness, it will be very difficult to develop or generate in the children. But other aspects we can apply successfully, more or less successful fashion. Anyway, it depends upon the patient and the nature of the problems, actually, as far as I know.
Thank you, Jenny,
Thank
ma'am.
you, ma'am.
Good evening, madam.
Yeah, Gayatri, ma'am, please go ahead.
Thank you, madam. Your session is awesome as usual. So,
Yes, sir. Thank you.
yeah, with your PPT, I got one doubt. Is it working with women only?
No, not like that. You might have seen that the list of
List. Yeah,
studies
that's
women.
yeah,
Yes, it's not like that. That is
yeah,
this. One thing is that at the time of the studies conducted,
yeah.
we can say that this it is not females actually, but the studies I have quoted are showing the female
Yeah.
population. Yes,
That's
it's
right.
true
I
that.
got that.
Yes. It's not
Okay.
elderly depressed with there are some studies in between, because this borderline personalities, because of the nature of the samples, it is not focused on women population. It's not like that.
Okay.
Anyway, borderline personality, regarding the statistics, we found more in women. There is one point like that. And this year 2006, yeah, madam, you are correct. My samples, my papers are exhibiting the women
That's why I
population,
got doubt,
but it's
madam.
not like that.
Okay.
I can send you some more studies which is in
Okay.
which the male population is also included.
Yeah, thank you,
Okay.
ma'am.
Thank you, madam.
Yeah, Suresh, sir, can you share your knowledge on this? DBT.
Pardon?
Yeah, Suresh sir also joined. He
Ah,
will throw light on this DBT.
okay.
Yes, sir,
Yes.
please.
No, no, no. No. No, no. I have some clarification. Can I?
Sir.
Yes,
Okay.
sir.
Thank you. Thank you. Ma'am, as you mentioned that we have to go for to get an effectiveness of this DBT for at least 54 weeks. I am doing counseling and therapy since 2018 onwards.
Yes, sir.
As per my record and my friend circle record, I never find a client who comes more than 3 sessions. How it is possible to
I
have
didn't get you,
to make
sir.
an
Last,
effective of
I'm
16 week
sorry.
or 52?
Can I?
Sorry. Actually, in India, we can have a
Yes,
client.
sir.
They may follow for at least 3, not more than 3 weeks, man. Not more than 3 sessions, as per my knowledge and the record what I'm having for the last 5 years, and my friend circle also I have visited, and I'm having some of the documents. Mostly, as per my research in local area, in Indian context, I can see nearly 67% they are not going for second session. But you have mentioned that DBT will be effective. It is at least 16 weeks. But the data showing that no one is going more than 3 weeks.
Yes.
The follow-up is not there for counseling. How we can adapt that DBT for Indian context?
Data says that not more than 3 weeks. Yes, 3 weeks. Please read. I need clarification regarding the statement. Data says more than 3 weeks. Please clarify, sir.
It is
Ma'am,
here in
actually,
Indian
that's voice is
client.
In Indian context,
No,
you are
no, in
speaking
Indian,
about Indian context, and data says that DBT practiced in India is not going beyond 3 weeks. I mean, you are saying
no.
that like that?
No,
No, it
no,
is not
ma'am.
about DBT.
Sir's voice is
It is not
breaking.
about DBT. It is about
Sir,
gentle.
wait.
Ma'am, it is not about the DBT. In India, anyone who go for any kind of counseling, it may be any kind of
Yes.
problem or any kind of wellness component.
Therapy,
What we
yes.
notice that the record what I'm having nearly, I can say that more than 500 cases of mine. And the other cases I know from my friends circle. I never find an Indian client can go more than 3 weeks.
Yes.
Maximum 3 sessions they will come. After that, they will not continue.
They will not
And
continue. Yes.
this is the status of in India.
Oh, yes,
And
definitely. Very true.
and DBT and almost most of the sessions in Western countries, they say that it will be effective at least 16 sessions. And I don't know if anyone has done a 16 session in India. I think I need to see them, and and how it will be effective for our context, how we can adapt that DBT for our Indian context.
Yes, yes. Adapting a therapy for our country, rather than I would like to adapt any therapy to depend to our nature of our client and the nature of problems. And regarding the patients quitting the therapy after 3 or more weeks, I would like to say that there are so many factors that encourage a patient in order to stay in the therapy. And one must be financial factor will be there, and the relationship between the therapist and the patient will be is one of the most factor, and the ability of the basic ability or ability of what we say the resilience or ability to persist in the therapy and motivation of the patient. There are so many factors which determines whether the patient is going to stay in the therapy and find an beneficial outcome for him or her. So in Indian context, regarding the Indian context, I think that most of the financial situation of the patient is will be one of the many major factors for the patients leaving the therapy before it is completed. Financial factor. And what I should say that the expertise of therapist matters a lot. Expertise, regarding the expertise, that is, so many therapists are being now mushrooming all over India, claiming to have that ability to heal bipolar disorder, heal anxiety disorder, whatever it may. Come to me, I will heal you. I have this and this techniques, but they will not be having that basic, fundamental, experiential as well as theoretical, fundamental, strong fundamental aspects will not be there. Their fundamentals will not be so strong at regarding the experience also. And that is one of the reasons, one of the major. So in general, the persons depending upon the therapies lose faith in thing called therapy itself, though. So there is highly likelihood for them to depend upon medicines and all that, which will cure quickly, but it will not be cured in a deeper manner. We know that regarding the difference between the psychology and the psychiatric aspects. So there are so many factors actually. And your second question regarding how to incorporate DBT into our Indian context. Yes, cultural differences are there. This DBT has its origin in western side of our world, but cultural differences we have to study in depth manner how we can incorporate, first of all. And incorporating DBT into our Indian context must be a research-oriented approach, actually. There must be a research-oriented approach because we have to keep on studying. Yeah, that's what I can say. That is, we have to go long
I totally
way in
agree
order
with you.
yes, to go a long way in order to claim that this version of DBT is very fruitful for Indian patients, Indian context. And it must come, the initiative must come from the practitioners like you and me, actually. And a very concerted approach is needed, very planned approach is needed for that. In what ways we can
I have done my
change DBT? For answering that, I have to call you in person, or I need 1 or 2 hours in order to analyze in what all ways, what all changes we can make in DBT. If you ask, we have to study. It is an answer that it is a question that needs extensive answer, detailed answer, I think. Thank you, sir, for this prompting, this encouraging question.
Yeah, thank you, ma'am. Thank you, sir. From Reshma Astana, can explain what is radical judgment? It's in chat box, ma'am.
Yes, okay. Thank you. Thank you so much. I enjoyed the session and the questions well, and I will be here once again, again and again. And yes, thank you.
Yeah, Madeline, you can go for VOT.
Dr. Jenny, on behalf of Deccan Positive Mental Health, I'd like to thank you for this wonderful session. You provided an overview of DBT, but this is the first time I'm actually learning about DBT, and I'm sure like there are many participants who are learning about DBT for the first time. And I like the way you, in a very simplistic manner, explained how DBT can help dichotomous thinking, having the client to come to a middle ground, and keeping all stakeholders in mind. Like you mentioned, family involvement, because we have seen, like, as counselors, helping the client only cannot serve the purpose. We have to get other people also involved. So I like that you emphasize on this factor, that this approach requires the environment to be involved in the therapy process also. And the objectives you mentioned, how this skill training, acceptance and change can bring about a certain amount of transformation. You also like clarified a doubt that you cannot actually 100% heal somebody. That, like, you may mention that, okay, BPD or like bipolar can be completely healed. It's not possible. And I like that you mentioned that there can be certain level of transformation, so they can function on a daily basis without going to that place of dysregulation. So this is something that we have to be realistic in while treating clients and helping clients to get them to the level of functioning. So I like the approach in a very simplistic manner. You're a great teacher. You've been an educator for a long time. In a very simplistic manner, you put this across. So thank you so much. And we look forward to having more sessions from you.
Sure. There is a final word that. Thank you, sir. There is a final word I would like to say, that there is a website which explains everything, almost everything, 100% everything DBT. I will be sharing the link with you. I mean, with Vishal or somebody else. So it will help to know everything about DBT. Okay. Thank you. Thank you so much.
Thank you, Jenny.
Okay.
Bye, friends. Good night.
Good night.